Okay, I am here today with Dr. Brad Connor. Dr. Connor is a gastroenterologist who practices in New York City, and Brad is a specialist in travel medicine. In addition to having written several textbooks and research articles, he's also the author of the excellent chapter on traveler's diarrhea in the CDC Yellow Book, Health Information for International Travelers. Thanks much, Brad, for joining me today.
Well, thanks so much, Chris. Thanks for having me. And thank you for that very kind introduction. Thank you.
So, first question, the basics. What is traveler's diarrhea and just how common is it?
Okay, well, traveler's diarrhea is something that's probably known to most people. And I always say if you haven't had it, you obviously know somebody who has. It's diarrhea, which occurs during travel. And it generally occurs when you travel from a more developed area to a less developed area. Usually it reflects the local hygiene and sanitation infrastructure, and it's the onset of diarrhea that occurs during travel. That's the broadest definition of traveler's diarrhea. Very common. In fact, some estimates show that, for a trip to a moderate or high risk area, there's anywhere from a 25 to 40% risk of contracting traveler's diarrhea.
Okay, and this begs the question. Obviously, people want to get this as infrequently as possible. What are the best measures to try to minimize the odds of getting this?
Right. So keep in mind that traveler's diarrhea historically has been a bacterial infection. It's an infection that you get through eating contaminated food or drinking contaminated water. There are other causes. Parasites, viruses can also cause this. How do you prevent this? Well, just by knowing, first of all, that you may be at risk. So to oversimplify it somewhat, if you're traveling outside of the US, Canada, Western Europe, Australia, New Zealand, Japan, at least think that there might be a risk of traveler's diarrhea at your destination. Now, of course, there are some destinations that are higher risk, parts of Mexico, South Asia, India, parts of sub-Saharan Africa. What you should know, first of all, is a wise selection of food and beverage, and we can discuss that a little bit. That's probably the most important information that I could provide.
Okay, okay. And street stands, there's a lot of good food. I see Anthony Bourdain at street stands on his TV shows, and he seems to never get sick. Can you make any statements on the general safety or lack thereof of roadside stands?
Yeah, in travel medicine, we always or often say avoid roadside stands, avoid street vendors. However, I'll qualify that a little bit. In general, we know that foods that are freshly cooked and served piping hot are
Mhm.
usually relatively safe.
Mm,
It's foods that sit out for a long period of time. It's the salad, the buffet. It's
mm.
a plate of lasagna that may be on a shelf and reheated at your restaurant. So, although street vendors, we caution against street vendors, I would use the caveat by saying if it's a very popular street vendor with hot, freshly cooked food, it may be relatively safe. Now you have to, sort of weigh and balance the risk benefit ratio. Anthony Bourdain, of course, and a lot of travelers are one of the pleasures of travel is eating new foods. So look, if you're willing to take some calculated risk, you might want to consider that. On the other hand, keep in mind the food vendor at the kiosk or the stand, where do they wash their hands? Where do they go to the bathroom? And these are questions that you need to answer. So strictly speaking, avoiding roadside stands and street vendors is smart, but as I said, you can temper that with a little bit of common sense.
Now, concerning regular hand washing, I know there's some benefit with things like COVID and influenza. Any benefit with traveler's diarrhea?
Well, I think we're more aware of the transmission of infectious diseases. So along with that, proper hand washing has become very common, both in daily life here in the United States and also in travel. So I think if you're washing your hands a lot, especially washing before you eat or using some sort of antiseptic towelette or something, that helps. That does help prevent at least the germs that are on your hand from working their way into your mouth.
Okay, good. That's good to know. Um, Suppose someone gets traveler's diarrhea. When do they know when it's a good idea to consider taking a medication, and what medication might they take to shorten the symptoms?
Yeah, it's a good question. When we discovered that most travelers' diarrhea is bacterial, we also realized by taking an antibiotic, and back in the day it was something like Cipro, and now we use azithromycin. These are very effective at eradicating the bugs that cause most travelers' diarrhea. On the other hand, by taking antibiotics unnecessarily, it can increase your risk of developing what we call antimicrobial resistance, picking up genes that might confer resistance on antibiotics should you need them when you return. So it's a bit of a balance now. It used to be where, if you got traveler's diarrhea, just take one pill. At this point, we say if it's manageable and if you're at a hotel and you can run to the bathroom and perhaps take Imodium, which is something that slows down the diarrhea, or Pepto-Bismol, that might be good enough. However, if it's serious diarrhea, really severe, sudden onset, you're really sick, or you've got to catch a bus, then a dose of an antibiotic might be appropriate. We've also found instead of taking a long course of antibiotics, sometimes single dose therapy, 1 or 2 pills,
Mm.
is enough to eradicate the bacterium. And also, we tell people who travel, bring the antibiotic with you in your travel kit. Have it with you because you don't want to have to look for a doctor and access medication when you
Right.
travel. So, as part of the travel clinic, and you know this as well as I do, that discussion about traveler's diarrhea, that prescription for the antibiotic is part of what we do in the travel clinic.
So it sounds like not just for immunizations, but getting a standby medication for an antibiotic is part of why it's a good reason to see a pre-travel provider.
Absolutely. The thing about travel medicine is it's not just what shots do I need for this trip, but it's a whole bunch of very useful information. So I always tell people, go to the best travel clinic. They're going to discuss altitude illness, they're going to discuss malaria, they're going to discuss traveler's diarrhea, along with the vaccines that you need. So traveler's diarrhea is certainly a big part of that discussion.
Good, good. Now, suppose someone goes to a low-income country either repeatedly or is there for a long duration. Do they build up some resistance to traveler's diarrhea over time?
It's been found that just going periodically may not be good enough for that development of immunity. However, if you're assigned, let's say assigned by your company to go to a developing country and you're there for a period of time, we find in the first 2 years you behave as if you're a tourist or even a newborn infant in that country, and that you're going to get repeated episodes. After 2 years, you develop some immunity. So
Okay.
apply to the repeat traveler, but it does apply to some extent to the long-term expatriate.
Okay, so 2 years, that's a long time. So
It
six
is a long,
months,
it,
really no
it, it is
benefit.
a long time. Yeah.
Okay.
The other question that might come up along those lines is there a vaccine for traveler's diarrhea? And currently there's not. But there are some that are that are in development that may be appropriate in the future.
When on the internet and elsewhere, social media, a lot of people talk about the benefits of probiotics for reducing the risk of traveler's diarrhea. What's
Yeah.
the evidence on that?
The evidence is mixed. Probiotics are bacteria that confer some health benefit on the host. Some studies show a benefit of some probiotics, and other studies show absolutely no benefit at all in either preventing or treating traveler's diarrhea. So right now, the jury is mixed. In fact, the Department of Defense is gearing up to do a big study looking at probiotics, prebiotics, um, immune globulin preparations, and placebo as potential prevention of traveler's diarrhea. So once these studies are done, we'll have better information. Right now, not enough information to tell you that's going to be helpful.
Okay, good, good. Now, suppose someone is in a low-income country, it's hot, they're thirsty, they want water.
Yeah.
Should they go for bottled water? Should they go for boiled water? Should they add iodine? What are options? What do you think is best?
Okay, so most travelers have the option of getting bottled carbonated beverages. If it's a bottled carbonated beverage, sparkling water, Coca-Cola, beer, those it's a pretty good bet they were bottled at a bottling plant because they're carbonated and that they're okay. Second to that would be bottled water that's sealed. If the seal is on, pretty good bet. Sometimes you'll order bottled water and they'll just fill it from a tap in the back of the restaurant, and you don't know that it's really bottled water. So, and then again, if you're the type of traveler who's in a remote area and you don't have access to that, then we always talk about boiling and filtering. So boiling kills bacteria and viruses, and filtering kills the parasites. So that's the surefire method is both boil and filter, but for most travelers, you have access to bottled carbonated beverages. And also be careful of ice. A lot of resorts in developing countries serve very attractive mixed drinks and cocktails, and the ice may not be pure. It may be made with local tap water. And studies have shown that even 90 proof alcohol doesn't kill the bacteria in ice. So just buyer beware.
So learn how to say without ice in whatever language of where you're going to.
Exactly. Exactly.
Good. Well, I don't have other questions. I want to thank Dr. Brad Connor, New York City. Thank you so much for that very professional overview of traveler's diarrhea.
Thank you very much, Chris. Thanks for having me.